All right, so we're going to talk about uric acid tonight. And so my whole journey down into this thing about uric acid came a few years ago when I was heavily involved with treating diabetics, helping people with type 2 diabetes to reverse that condition. And I realized there were you know, issues with running blood work. I found we need something. These uric acid levels are too high. How are we going to lower them down? So I started, learning more and more about what it was. And then I saw how important it was and how it was really impacting those people with diabetes that were struggling, that were not moving as long, improving as quickly as we wanted. And so I started gathering all I could on it, and I sent what I had to Dr. Kim and said, please, the brainiac that you are, please fix this, make something beautiful for me because I need it for these patients. And of course, he did it. And that's what we have in Uric Min. So let's talk about this uric acid thing. I got to remember how, there we go, we're advancing. So in school, I don't know about the rest of you. I started school in graduate school in 1989. So back then, we were really taught very little about uric acid. Pretty much, if you didn't have a gout, if you didn't have kidney stones, we don't really care about uric acid levels. So it just wasn't a big deal. Now, the normal lab values of uric acid are considered to be there about 4.0 to 8.5. And keep in mind, lab values are of a sick population. It's the average of a sick population. So from a functional medicine standpoint, we really don't want anyone over 5.5 in their uric acid levels. If you are above 5.5, damage is occurring. And when we show you tonight how much damage this thing can cause, you're going to wonder what your own levels are, I promise. You'll think about you before you start thinking about your patients. So let's go to the next one down. There we go. This is a quote from a 2009 American College of Rheumatology study. Elevated uric acid is responsible for 16% of all cause mortality. Regardless of why you died, they figured everything in, and it was 16% of the time. That's outrageous. And as far as cardiovascular disease goes, uric acid levels being elevated is responsible for, at least in a major role, 39% of all cardiovascular deaths. And when I read that before, I would think this can't be right. This can't be right. But as we get further into this thing, you're going to see how it suddenly becomes a bit believable. So in this little chart that I made, this is what my personal, now you're going to see some of my personal notes. I geek out when I'm doing these things, and this is my lifeblood. This iPad I carry it with me everywhere I go. My notes of all the books I read. I have 30 pages on uric acid, and this is what they look like, only hand drawn. This is a pretty one. So if you look at uric acid and where it's implicated, if you just go to the side and see systemic inflammation, systemic inflammation is implicated as a major role in every single one of what we call chronic or aging diseases. Now, our healthcare system, as far as crisis care goes, is by far the best in the world, as far as I'm concerned. The problem with it is that they treat every condition in the body as a crisis condition. And crisis conditions merit usually something very aggressive, like a pharmaceutical drug or surgery. That's really the tricks in the bag for most of them. And we know that that doesn't work. And how do we know that? Because we have never had the kind of rates of illness, chronic illness that we have today. In fact, if you want to do this test, if you take your spouse or your significant other and go to a Walmart and park where you can see the doors and let the significant other go in and do some shopping, and you sit there for 20 minutes, you will see all of these sicknesses, sometimes in their pajamas, going in and out of Walmarts. You see it all. So systemic inflammation is at the heart of all of these, and we're talking about Alzheimer's disease, avascular dementia, heart disease, stroke, type 2 diabetes, metabolic syndrome. All of these things we're going to talk about tonight is all implicated by systemic inflammation, and something that isn't on this list is autoimmune disease. Now, I know all of you out there are seeing the rising levels of all of this. And as we get a little bit further in here, we'll talk a little bit about the children, because we're seeing diabetes, type 2 diabetes in children as young as 6 years old. we're seeing ADD and ADHD problems. Their brains aren't functioning correctly, and uric acid can tie directly into all of that. So that's just systemic inflammation. It causes high blood pressure, heart disease, and through inflammation, it causes all of these things. But there are other pathways that bring us to heart disease. It inhibits autophagy. It causes obesity, metabolic syndrome, type 2 diabetes, dementia, Alzheimer's, kidney disease, and more. And if all of that doesn't scare you, man, the very last one I held for last is erectile dysfunction. Uric acid is a big player. It messes with nitrous oxide in the tissues of the brain, the heart, and the sex organs. So we have a real issue here with uric acid. So the cause of uric acid, if you remember back in the day, what were we really taught? Oh, it's the disease of the kings. They're eating shellfish and red meat and pork, and they're drinking a lot of beer. That's the reason you get gout. It also comes from a high caloric diet. It comes from drugs like diuretics, aspirin, levodopa, and immunosuppressants, cyclosporin and tacrolimus. Now, personally, I take tacrolimus every day because of my kidney transplant. So there is a 3-page printout of all of the things that bugger causes, and I'm trying to fight against every one of them. And it's type 2 diabetes, uric acid problems, neuropathy. It is a bad, bad drug. But it's between that and giving up the kidney or, no, anyway, I won't go down the path. That's another subject altogether. So keep in there, the other things we're not thinking about as far as uric acid is the way we sleep, how much sleep we're getting, is it quality? MSG, which still is in food everywhere, even though they claim it's not there. But the one that has been missed is this thing called fructose, and most specifically this high fructose corn syrup. And we're going to talk about that in some depth tonight before we're done. So uric acid inhibits autophagy. Now, I have to tell you that when I was in school, it was a British, or at least a British accented medical doctor who taught this to us. So for 3 decades, I called it autophagy. And people must have thought I was an idiot. It took me 3 decades to figure out I was talking about autophagy. But if autophagy, if you'll remember, is just the body's way of taking out the cellular trash. It looks at the cells. Can we repair them? And if so, we repair them. Can they not be repaired? Let's eliminate them. Let's kill them off and let's move them out. That basically, in a tiny nutshell, is what autophagy is. It is a super important thing because autophagy decreases neurological disorders or protects us from those. It decreases inflammation in our body, which we just said was at the heart of just about everything that's killing America. It removes the cellular trash and debris. I did say that. It decreases heart disease. It decreases autoimmune disease. It fights off cancer. Autophagy is critical, and high uric acid levels are destroying that. And as we talk about what uric acid levels do, and I have these little things, these little charts, in truth is a spider web. And I can't even put my more complex charts because I'm not sure I always understand them. It is intertwined. I was getting about to say a joke that was really not right, so let's go on. Let's talk about nitrous oxide. Now, increased uric acid depletes our nitrous oxide production. So that leads to hypertension. Nitrous oxide depleted will decrease the blood flow to our organs. It impairs our memory, so leading to Alzheimer's and avascular dementia specifically. Synaptic neural transmission. It increases insulin resistance. So this is just one of the other methods or pathways that uric acid is damaging our bodies. And keep in mind, we can be on the high levels of what's considered normal, and all of this damage is still taking place. So let's go on to here. Now, what I put in here, this is what my notes look like in my iPad. And I apologize. I wanted to bring this up, and I didn't do this in the last presentation. But I just wanted to show you that uric acid and sleep patterns are very important. And one of the problems in America, people don't sleep. It's one of the hot ones. It's like weight loss. You want to talk about sleeping habits, everybody gets in line. So I just wanted to talk a little bit about what proper sleep is. And proper sleep patterns occur in 90-minute cycles. So we shift from deep non-REM sleep to REM. So the deep non-REM sleep is really when we physically recover and rejuvenate. It's physical renewal. And if you can read my writing in the red there, basic C said is the lymphatic system rids the brain of toxic metabolic waste, including beta amyloid protein, which causes Alzheimer's disease. So it basically washes the brain during that period of time and cleans it up and gets all the stuff out of there that shouldn't be there, which is metabolites are a big part of that. And then we shift into an REM portion of the sleep, and that is our key to learning and memory. So during that part of sleep, our memories are consolidated and they're organized and they're filed away. And without that, we can't hang on to them. So sleep is very important just for those reasons alone. But if you look down below, and we can print this up for you later in readable fashion. But when you get down into here into the brown, uric acid peaks early in the morning, just like cortisol does. And it's when most gout and heart attacks occur. 1 week of poor sleep can negatively impact over 700 genes, which results in impaired function relating to immunity, metabolism, stress response, inflammation, repairing damaged tissues, and potentially worsening every single chronic disease. Sleep is critical and it's important. For most people, this is in the yellow, less than 7 hours of sleep per night results in chronic sleep deprivation. So it's easy to spot the symptoms of sleep deprivation because it's like all of these chronic things that are going on in our brain fog, confusion, memory loss, decreased immunity, chronic infections, craving for simple carbohydrates, weight gain, obesity, type 2 diabetes, cardiovascular disease, anxiety, and depression. And it's just a whole host of different chemical pathways that we could map out that cause all these things. And what I didn't have in there, I typed on the side. I want you to realize that sleep deprivation and uric acid set us up for an increase in inflammatory cytokines. Now think back, where did most of us start really getting interested in inflammatory cytokines? It was during COVID. And the American public thought, in their mind, some people get a lot of COVID and other people get a little COVID. So those that get a lot of COVID get sick and die. And those that get a little COVID, they just get the sniffles. And that nothing could be further from the truth. People who got COVID. And if their body was able to take care of that issue, they took care of it. And when they couldn't, they got very, very sick. And that cytokine storm was part of the problem. And if you look at these, you don't have to remember all of these. Interleukin 6, interleukin 1 beta, that's supposed to be a beta, C-reactive protein, and TNF alpha. Now, C-reactive protein is the only one we normally look at on lab values of these. And it is predictive of a heart attack. It is a heart value, but it also shows us systemic inflammation. C-reactive protein is a big one that we work with. So this is how just plain sleep patterns. Now think about the people in your practice, the people you know. I deal with a lot of people. My average patient is over 60. And sleeping poorly, I would say 8 out of 10 patients deal with this. And it has to do with a lot of different problems. A lot of it's brain chemistry, a lot of it's the food they're eating, a lot of it's pain, other things that are keeping them up. Neuropathy can keep you up. So dealing with that in whatever fashion we need to is actually very important. So we're going to spend the rest of our time on this. So the number one Mac Daddy in our society today, driving up uric acid levels and causing illness, is this guy, high fructose corn syrup. He is in 74% of every product in the grocery store. Now you think about what's in there that you know they can't put it in. And it's in just about everything, it seems. High fructose corn syrup, we're one of the few nations that allow it in our diet, to be allowed in the food. Most companies have banned it, and there's a good reason why. Let's go on. Look at this. I apologize. This is fructose metabolism. I didn't talk about it last time, but I just want to give you some idea. Now, sucrose is the sugar of energy. And we think fructose, I'm going to eat an apple and I'm going to get all this sugar and have this energy. But fructose is actually the sugar of energy depletion. So you eat fructose in whatever form you do. Obviously, it's way better on a piece of fruit with all the other things that comes with it. But most of us are getting it through high fructose corn syrup. It's quickly absorbed into the bloodstream from the gut, and it goes right to the liver for processing. Now, if you follow this along from the big liver guy I got here, this block, It activates what's called fructokinase, and it begins to break down the glucose, consuming massive amounts of ATP. That's our energy, right? So our energy is actually depleted in the cells by 40 to 50%. So it causes mitochondrial dysfunction, it causes energy depletion, and it has rapid rises in uric acid levels through this pattern. The ATP is converted to AMP, which is adenomyophosphate and adenosine monophosphate, and then uric acid is the byproduct. But what it tells the cells start crying out for energy. And that's my little megaphone there saying, we're running out of energy, we're starving. We need to store all the calories as fat. We need to store everything we can. Feed us, feed us, feed us. And so the more of these things you eat, if you sit down with an Oreo in your hand, you eat it, you're standing back, you're going back to the kitchen to get the bag. You're starving for it, right? So that's why we got to get those things out of our diet. Now, as you follow this down, you can read this. In this, high uric acid levels keep fructokinase activated. It doesn't have a shutoff valve. It doesn't have a negative feedback. So the sugars, the high fructose corn syrup keeps fructokinase in action. So it keeps breaking down and stealing our energy away. It exacerbates the energy depletion. It increases the mitochondrial dysfunction. It promotes inflammation and oxidative stress. It raises the blood sugar, increases insulin. It triggers production and storage of body fat. It triggers hunger and thirst. We won't be talking about that tonight, but I almost brought that in here, but there is no negative feedback system here. So that's why high fructose corn syrup is the monster that it is. And it's why it's put into the foods, because it's cheap, it's very sweet, and it has us coming back for more. And it's the number one implicator in a lot of diseases. Look at this. High fructose corn syrup goes to the liver. What does it do? It significantly raises the uric acid. It causes mitochondrial dysfunction, energy depletion, systemic inflammation, increases insulin dependence, decreases the dopamine signaling, which ends up hurting our children and causing more ADHD. It decreases the nitrous oxide in the tissues, which is damaging to the heart, to the brain, to the sex organs. It's lipogenesis. It means it's creating more fat, creates a fatty liver. Fat production and storage damages the pancreas. It damages the islets of the cell. And they can't produce the insulin the way they're supposed to. Raises the blood sugar, promotes that dementia and Alzheimer's. Now, is that not scary enough for you? Here's the answer. There are answers to repairing this and lowering the uric acid levels in our body. And Uric Min has all of the special things in it that we need. I've got a paper here that's got all of the ingredients in there, but I just want to read them to you really quickly. It's got vitamin C, B6. Quercetin is really important. I'll just cut through here. Tart cherry, asparagus, bromelain, devil's claw. If you start getting into these things, in fact, this is what I love. If you start putting these ingredients just in Chat GPT and say, oh, tell me how this impacts uric acid levels, you're going to be amazed about all the ways and the pathways that these things impact it. So Dr. Kim put these things together, and this product works beautifully. We started using it with our diabetic patients with every single one of them, and it shows up really nicely. And with my situation, I'm on there too, and it drove down my uric acid levels to a healthy state, and I haven't actually had to go back on it in a long, long time because of that. That's kind of a fire hose of the evils of this uric acid problem, especially with the high fructose corn syrup. And if I keep going, we're going to be talking about other things in these slides. So I don't think we need that. We just need to finish with that beautiful picture right there. You know, we didn't see any. This product really does well with people. It didn't seem to, we didn't see stomach upset. Now, we always recommend that they take it with food, but we didn't see any. Now, doesn't mean there couldn't be somebody who's sensitive to some of the ingredients, because that's always a possibility, but it's not common. We just have never seen one. You know, I think really the best way is through blood work. And I know not everybody orders blood work. So to me, the next best way would be muscle testing. And the reason I like blood work is I am the world's worst muscle tester. If I want to test myself, I ask my wife to do it because she's a master at it, but I'm terrible. So I do blood work, and you can just run that. It's an inexpensive test. You can actually set up what we've done with the lab. We work through Evexia. And we send people over to LabCorp that are all over the world. or at least all over the country. And in LabCorp, we can get about $3,500 worth of labs done for, I think my cost is about $300, somewhere in that range. And that's another soapbox to get on why they're profitable at me at 300 and they charge everyone else 3,500. But that's what we do. We'll run a big battery of tests, including it's the C-reactive protein. We test that way as well. We have a device in the office that correlates with C-reactive protein, so we don't have to send them out. We can run this test. It's called a TM flow. But it took us a long time to figure out how to run and understand that test. It's usually in a cardiologist office, but for us, it fits what we do a lot. So we run those tests. We run those tests 2 or 3 a day.
Or if you are dealing with your clients dealing with too much of fructose corn syrup, and glycol product is very, very important. And Dr. Norman mentioned that you can do the blood test for the uric acid, but I heard that some practitioners are mentioning that if your urine is a little above the normal level of uric acid, you might have a little more bubble when you pee to the toilet. So you can kind of watch if there is too much bubbles in your toilet when you urinated, and that's also kind of signs of a little bit of too much uric acid in your urine. And also your urine is not really clear, a little bit of a cloudy, and then that's also a sign of uric acid. Of course, the best way to monitor your uric acid level in the urine is blood, but these are some other tricks that you can recommend your clients to look for it. So if your urine is a little too cloudy, too bubble, that's also some sign. And also you can buy the pH measurement, the strips, that's normal. You can even buy it from Amazon. And of course, that's not only the urine, but you can also measure the pH of your urine. If it's not by uric acid, if urine is too acidic, that's not a good thing. So that's another maybe way that you can measure uric acid in the urine.